think so. I can start.
Yes, doctor, you can.
Hello, good afternoon, doctors. Welcome to this webinar on the role of Oseltamivir in flu management. This webinar is brought to you by Heathrow Healthcare, an innovative pharmaceutical company. With Heathrow Healthcare, the journey began in 1993, has got 30 plus years of excellence and 36 state-of-art manufacturing facilities. Heathrow Healthcare has 300 plus products in portfolio and presence in 126 plus countries. Heathrow Healthcare has 21,000 employees globally and is the largest closely held pharmaceutical company in India. Heathrow Healthcare is among the largest manufacturers of ARV, APIs, and FDFs in the world and has Asia's largest API manufacturing facility at SCZ Complex, Visakhapatnam, Andhra Pradesh. Heathrow Healthcare is 360-degree solution provider, striving to fulfill unmet healthcare needs, reaching to customers across India with wide product range encompassing multiple specialties. Heathrow Healthcare pioneers in quality and innovation and has the distinction of bringing 4 biosimilar products to market within 5 years of initiation. They are darbepoetin alpha, rituximab, bevacizumab, and adalimumab. During COVID-19 pandemic era, Heathrow Healthcare, the pioneers in antivirals, offered oseltamivir, favipiravir, and remdesivir to the patients, because of which in August 2020, Heathrow Healthcare received an award of Pharma Excellence for COVID drugs. Today's webinar, we have got Dr. Pramod Jog sir as our moderator. Dr. Pramod Jog sir is MD, MN, AMS, FIAPI, FICMCH. Sir is PG Diploma in Pediatric Infectious Disease, Best Performance at ADVSC France 2011, MA in Sanskrit and Proficiency in French and Spanish, Director WOM to 18, Professor of Pediatrics at DY Patil Medical College, Pune, National Pediatrics, National President, Indian Academy of Pediatrics, IIP 2016, Standing Committee Member, International Pediatric Association, IPA, Steering Committee Member, GAVI, CSO, SC, Standing Committee Member, ASPID, Consultant Pediatrician, Medipoint, Jupiter, Ankura, New Sangui, and Dinanath Hospital. Sir is Senior Consultant to UNICEF and a member of Maharashtra State Pediatric COVID and Measles Task Force. With this brief introduction, I hand over the session to Dr. Pramod sir. Over to you, sir. I stop sharing.
You. Thank you. Right. So, Dr. Prashant, my slides are visible?
Yes, sir.
Thank you.
Clearly.
And my voice is also audible?
Yes, sir.
Okay.
Yes, sir. Clearly.
Right. Yeah, because recently in one of the meetings, there was, some panel and somebody asked whether I am visible and audible. So someone said, in addition, you are also somebody said you are also horrible. Okay, so
Sir, your wit is unparalleled.
Anyway, so we will start with the discussion of the use of oseltamivir in flu management. Okay, and if you can see, my name has been put in the style of influenza virus, because every influenza virus has its own way of nomenclature, which tells as to the place of origin, the year of origin, and so on and so forth. And as you told in the introduction, I have been the IAP presidential strain of 2016. And just as the presidents of our Indian Academy of Pediatrics change every year, even the strains of influenza, they keep changing every year. And I will tell you certain details about it as I proceed in my presentation. So recently I came across one small little child in the OPD, and this 5-year-old girl had come with a doll in the hand. And while I was examining this girl for fever, cold, and cough, she was speaking to that doll and telling her, see, you have viral infection, you have viral, it's viral, it's viral. So I was surprised that even small children these days know the word viral. Okay. And long back, I remember the days when we were not much worried about this word virus, because we thought it's a self-limiting condition, and without giving antibiotics, the things would go well. But that particular concept got little bit of a shock when in 2009 we had our H1N1 pandemic, when we could see that in the second phase of influenza, these children, they started worsening because of something like a cytokine storm. And even during COVID pandemic, we saw that after 5, 6, 7 days, adults, they started behaving differently. All these were related to the cytokine storm. And that's why whenever you come across any child who has symptoms suggestive of viral infection, it is important that you observe the patient and see the patient again after 5 or 6 days and see that they come back to you in the OPD, so you know that they are not worsening and something else is not going on. This biphasic nature is known for certain viruses, including influenza. We are all aware of dengue fever, which also has a biphasic presentation, and that's why one should remember that quite few challenges related to these viruses. They create problems like H1N1. H1N1 actually is influenza, but the common term used for fever, cold, and cough is influenza-like illness. And influenza is the father of all those influenza-like illnesses. Okay, what do I mean is a child coming with cold, cough, and fever has something called as influenza-like illness, but influenza, the virus, will produce problems like severe headache, fear with chills, pain in the muscles, and weakness. So, when all these come together, this particular child has a definite presentation like influenza. And it is important that in the days of monsoon or even in the parts which are post monsoon, whenever a child comes with similar complaints, one has to be suspicious about influenza. Remember, whenever parents bring even an older child, say 9 or 10 or 11 years old, lifted on the shoulders, it is important to ask some of these probing questions, whether this child has headache, whether he has muscle pain, whether he is feeling weak, and all these, if they are positive, it strongly points to influenza. Okay, and the incidence of influenza and the related deaths has been increasing alarmingly in India, and that's why we must know the KYC. The KYC is the term that we use in the transactions in the bank, where it's the know your customer. But this naughty influenza also has its own KYC. So influenza A, influenza B, and influenza C. These are the three types of influenza viruses, of which of particular interest are influenza A and B, particularly for the human beings. Influenza A produces frequent epidemics, and these are minor antigenic variations. The amino acid sequence of the glycoproteins present on the outer side of the influenza virus, they, usually the sequences keep changing every year. And that's why we get, alteration in the structure of the virus every year. These are called as antigenic drifts. However, periodically we get pandemics, and these are because of the major antigenic variation, and I will come to it in a minute. Influenza B viruses, on the other hand, they infect only the human beings and cause local epidemics. Okay, and there have been four major global pandemics. What happens is that influenza virus usually circulates in the atmosphere, and it's the one which affects either the birds or the human beings or the pigs. Now, the most important thing is that the pigs, for example, in 2009 pandemic, acted as a mixing vessel, where the virus from the bird and the virus from the human beings got mixed up, in the body of the pig, and totally different influenza virus came into picture. Okay, so that was called as a novel H1N1 influenza virus. And similar problems had occurred in 1919, 1957, and 1968, when there were major changes. And these major changes in the structure of influenza virus lead to what are called as pandemics. Pandemics are the ones which occur all over the world. Okay, and this virus, it spreads by the respiratory route, and it spreads up to about 6 feet away, and they are mainly transmitted by droplets which are made when people with flu cough or sneeze or talk, and these droplets can land in the mouth or the nose of the people who are nearby, or possibly they could be inhaled into the lungs. And most of these influenza like illnesses have some overlapping symptoms like fever, cold, and cough. There are some distinguishing features. Just as I said, influenza has its own features. We know that in COVID, we had rapid progression to the lungs, producing breathlessness. There was also loss of smell and loss of taste, and so on. Remember, all these are viral infections, and that is why some of the features of these viral infections, like vomiting, like diarrhea, okay, they are also known. That is because viruses produce a generalized infection. Viruses do not restrict themselves only to the respiratory system, though predominantly we have respiratory viruses. Predominantly we do have viruses which attack the GI tract, like rotavirus. But being a generalized infection, some of these viruses can also produce vomiting and diarrhea. So don't be surprised if a child with influenza comes to you with vomiting and diarrhea, okay? And that's why once a child is brought to you, it is important to know whether this child is, getting worse or whether he is recovering. Viral infections, by and large, they will recover in 4 or 5 days. But if the child continues to have problems like fever, cold, and cough, fast breathing develops, or the child has a bluish skin color indicating cyanosis, indicating poor oxygen exchange, or the child is not drinking enough fluids or not waking up, not interacting, the mother will say, "Oh, Dr. Jog, he has been a very good child, and usually he behaves, quite well. But today, somehow or the other, he is not, behaving in a normal way." And sometimes these children are very irritable, okay, and the mother is unable to console the child, and sometimes these children can have rash also. So one should be aware of these emergency warning signs related to the sickness. That is because it is important to notice these changes so that we can put these children on oseltamivir, the antiviral drug, as fast as possible, because we know that this antiviral drug acts best when it is started before 48 hours of the onset of the illness, okay. And this flu, though it primarily affects the respiratory system from nose down to the throat, down to the trachea, down to the bronchi, to the lungs, it produces complications like ARI. These are the acute respiratory infections, which are manifesting as either pneumonia or acute respiratory distress syndrome or acute otitis media or absenteeism from the school or reduction in the amdani, that is the income of the parents, because they have to miss the office, and also antibiotic abuse. So remember all these problems associated with flu, which I have short formed into the alphabet A. Why this is important? Because people will ask you, sir, why should we give influenza vaccine to the child? Why are you so much worried about influenza? So you tell them that it's not only the viral infection that is important, but the complications are also important. So once I vaccinate the child, it is possible that the child doesn't get flu. Though the protection offered by the vaccine is to the tune of about 60%, it is important that we should offer this protection to the children as much as possible, okay. Now the treatment of influenza is largely supportive, and it consists of bed rest, increased fluid consumption, give plenty of water, give cough suppressants, and use antipyretics like paracetamol, and most of the patients of influenza recover in 3 to 5 days. However, the severe cases may require intravenous hydration and other supportive measures. And for the convenience of therapy, we have divided influenza into category A, B, and C. And the categories which are a bit serious, they require treatment with antiviral drugs like oseltamivir. Remember that oseltamivir is a neuraminidase inhibitor. So I will have to tell you as to what do we mean by neuraminidase. Remember, I told you that there are two antigens on the outer surface of the influenza virus, that is H and N. H is a hemagglutinin and N is a neuraminidase. Now, whenever the influenza virus enters into the respiratory system, let us imagine that it has gone down to the trachea, and there, it is now lodging on the respiratory epithelial cell. Hemagglutinin helps the virus to attach to the respiratory epithelium, and then the RNA of the virus, these are all RNA viruses. So the RNA enters into the respiratory epithelial cell of the human beings. Once it enters, these RNAs, they will dictate the DNA of the host cell, that is the human beings, the respiratory epithelial cell, to prepare similar copies as itself. So many RNAs are produced, like the influenza virus, like each RNA. So this is replication, and all these viruses are now ready to attack the other respiratory epithelial cells, normal cells. But the enzyme neuraminidase is actually waiting for these virions to be released, from the infected host cell outside. But the drug oseltamivir, which is a neuraminidase inhibitor, will block the exit of these viruses outside the respiratory epithelial cell, and that is exactly what we want. So even though infection occurs, even though the virus starts replicating, if you give oseltamivir early in the course, the release of the virions from the respiratory epithelial cell to the other cells will be halted and the severity will be prevented. So the progression of the illness will be prevented, the child will not worsen, it will not be necessary to hospitalize the child, and the chances that the child dies will be reduced. This is important. So this is neuraminidase inhibitor, and we have this particular effective molecule particularly for the treatment of influenza. And this oseltamivir has been a potent and a selective inhibitor of the neuraminidase enzyme, as I told you. And it's a prodrug which is converted to the active form oseltamivir carboxylate in the liver. And it inhibits the influenza virus replication and pathogenicity, and it prevents the further spread of infection. It was the first oral neuraminidase inhibitor, and it has been approved in more than 100 countries. It's given in the dose of 75 milligram capsule twice daily for the treatment of adults, which is given for 5 days. And for the treatment of children, it depends on the weight band. The dosages for children under the age of, under the weight of 15 kg or between 15 and 23, between 23 and 40 and above 40, they are different. And for therapy, they are given as twice divided dose, while for chemoprophylaxis, they are given as once daily dose. For infants and 2 weeks to less than 1 year of age, the dose is 3 milligram per kg twice daily. And in case if you do not remember the dosages, remember that the product insert is available along with the syrup form in pediatric practice, and you can just check the weight of the child and refer to the product insert and give the dose accordingly. Okay. Remember that there have been many clinical trials which have shown the benefits of the empiric and the early use of oseltamivir. And remember that in patients with influenza, oseltamivir treatment reduces the hospitalization and severity of the illness. And even the guideline recommendations from WHO, they say that empiric treatment is strongly recommended, and the treatment should be started as soon as possible. And the laboratory confirmation of influenza virus infection is not necessary for initiation of the therapy. Remember that the H1N1, H3N2, all these viruses in the throat, they can be detected by tests by doing the nasopharyngeal swab. Okay. However, remember that the positivity of the virus in the nasopharyngeal swab depends, particularly on the skill with which the sample has been collected. No doubt, if you find that H1N1 is present, after the nasopharyngeal swab report is available, then it means that almost in 95% cases, it is 100%, that these children have influenza. However, if the skill in collecting the sample is not up to the mark, then in, some of these children, one may not get the report positive. What you should remember is mainly the clinical features, as I told you, along with the epidemiology of the illness at that particular time, and what your colleagues are telling, whether, this influenza is rampant in the atmosphere. Okay. And that's why early empiric supportive therapy and monitoring is very important. And that is why it has been recommended that anti-influenza therapy like oseltamivir should be prescribed for children and adults who come positive for influenza. And also remember that it is associated with reduced risk of death in the hospitalized patients. Okay. And the treatment within 2 days of symptom onset or hospitalization results in the best outcomes. So recently we had a 3-year-old boy who came for fever, cough, cold, and progressive breathlessness over 3 days. The child was tachypneic with saturation of 85% in the room air, and this child was diagnosed as acute respiratory distress syndrome, and he was admitted to the PICU, ventilated. He received oseltamivir along with supportive therapy, and the throat swab was positive for H3N2. He was ventilated for 3 days, and then he was all right. And everybody started discussing whether early oseltamivir would have helped, this particular child. It is important that whenever there is a child who is previously healthy, presents with cough, cold, and fever, progresses over 3 days, and it is possible that the treating clinician can prevent the progression of the illness to seriousness. And particularly in the influenza season, it is important that you remember some of these important facts. Okay, so there are some points of confusion. I say, these are the points related to flu, and that's why these are the points of confusion. Like, whether this is bacterial or viral, whether this virus is rhinovirus, adenovirus, or influenza virus. If it is influenza, whether this is H1N1 or H3N2, and whether one should start oseltamivir upfront so that one plays safe. Okay, so let us see whether the incidence of viral infections has increased and what are the likely reasons. We are all aware that during COVID, adults as well as children were indoor and they were not much exposed to the viruses. So they did not develop the antibodies against some of these viruses. And that's why, as soon as the pandemic of COVID started declining, and when people started their movement, children came out of the house, when they started getting infections, they never had the immunity against some other viruses like respiratory syncytial virus or hand foot mouth disease, etc. And that's why the viral infection incidence started increasing. Even children, usually, when they go to the play group or, the KG schools, other children in the class, they also infect those children. And that's why these children, what it's called as back-to-back infections. Okay. And after COVID, we have been witnessing waves of different viruses like RSV. Then in certain areas where measles vaccination was poor, we witnessed epidemics of measles. Okay, and even older children, they were getting affected. We had hand foot mouth disease, we had RSV, we had adenoviral infections, so on and so forth. This is again another very common picture where a child comes with recurrent respiratory infection, or some children coming for adenoidal hypertrophy or adenoviral outbreak. Remember, this adenovirus is a different ball game. It's a respiratory virus, but I say that it has become a bad adenovirus. Why? Because it has started showing varied presentation. It has also shown prolonged illness, and many times the CRP also is elevated, even being a viral infection. Remember that generally, children are brought to the pediatrician after 3, 4, or 5 days. That is because initially the family physician continues to treat the child. And let us see this particular child, Viru. He has come to us with fever for 3 days, with cold and cough. He has been on metered dose inhaler since 4 months. He has been well controlled, and he has received symptomatic therapy. And he has come back after 3 days. He has been afebrile for a day, and the fever has developed again. And in between, he has been active. Now, if you analyze this case, you'll find that this child definitely has a presentation like a viral illness. Remember, whenever the onset is with cold, rest assured that it is, viral infection. So at the back of mind, you should remember that this is some infection by a respiratory virus. Okay. Now he has come back. He remained afebrile for a day, and then the fever again developed. The point is, the one that I was trying to tell you, that these days back-to-back infections are very common because children go to the play school where other children donate them the infections. And it is important that you counsel the parents about this fact. Tell them that about 8 to 10 viral infections in a year are normal in preschoolers. Very important. That is because these children are exposed to different viruses from different children. You just show them the growth chart and tell them that, see, the growth chart of your child is normal. So it means that the child is growing well and the frequent infections are not affecting his growth at all. Remember that. Also tell them that these infections are likely to be at shorter intervals, because as soon as the child recovers, he goes back to the school, there is another child waiting to infect him. Okay. And obviously these children, they do not require antibiotics, but some of them can have influenza, And that's why your antenna always should be on. And you must always remember to find out whether this child has very high fever, whether he has muscle pain, whether he has weakness. So once you analyze this child, you will come to know whether you need to put him on oseltamivir. Okay. So it is important to counsel the parents by telling them that, problems like cold and cough and fever are members of your family and they will grow with your child, but sometime or the other they will disappear. That is because the child builds up his own immunity after a few years, and by then, these infections become less common. Okay. And of course, one should know whether we can identify our enemies. So if the onset is with cold and sneezing, usually it's a rhinovirus, a common cold where there is only involvement of the upper airway, either mild or no fever, but the child is not exhausted and the child is playing well. In case if there is high fever, prominent headache, muscle pain, extreme exhaustion, then I told you this is likely to be flu. Adenovirus is a different ball game. Though it's a respiratory virus, it will produce pharyngoconjunctival fever, diarrhea, mesenteric lymphadenitis, and hemorrhagic cystitis. Okay, and under the age of 1 year, RSV will produce bronchiolitis, which is the infection of the lower respiratory tract, and the child will present with breathlessness, tachypnea, because there are no respiratory cough receptors in the lower part of the respiratory system. And that's why the presentation is with breathlessness. As we know that COVID-19 presented with fever and dry cough. If you think about the bacterial infections, which are supposed to be more localized, the fever is supposed to be high in the beginning and continues to be high unless you give antibiotics. And these children with fever, follicular tonsillitis, and tender cervical nodes basically have streptococcal infection. Okay. And this is called as a group A beta hemolytic streptococcus. If there is fever, grunting, and tachypnea, then that is pneumococcus. And if there is rapid progression and the child appears toxic, then it is staphylococcal infection. And in a child is above 5 years, predominantly coming with cough, then we call it as mycoplasma. So the information of the viruses and bacteria will give you educated guess. So you can guess as to what is the likely organism. Okay. Let us see another child who is a 4-year-old child with cough and fever of high grade since 5 days. And the child was not settling with oral medicines. So on admission, the child had tachypnea and needed oxygen support. HB was 11.6. The total count was 1620. Platelets were 132,000. There was mild derangement of the liver functions, and the nasopharyngeal aspirate was positive for S3N2. And this child was then diagnosed as a case of influenza with low WBC count and low platelet count. It is important to note that there is suppression of the bone marrow in influenza, and that's why these cell series, they appear to be on the lower side. It's also important to know that in monsoon, dengue is another problem. There again, the WBC count and the platelet count will be on the lower side. Even there could be liver function derangement. So one has to be very careful and find out whether these two are present. If at all this presentation and the investigations are of this nature, you should think whether you need to send the test for dengue also. And this is important. This is called as co-infection. And once in a while, you may come across such cases. Now, whether one should start oseltamivir empirically or after investigations. Remember, as I told you earlier, WHO has given a clear-cut statement that you can start oseltamivir empirically in the first 48 hours. Do not wait for the investigation report, particularly in children who are from the high-risk category. Remember, influenza has been divided into 3 categories for the purpose of simplicity. The first clinical grade A means that the child is, having cold, cough, fever, but he is not sick. He is playful, eating well, drinking well, etc. Now, the second grade or B grade is the one where the child has, bit of, increase in the respiratory rate. However, he is in general maintaining, his other parameters. But in case if such a child has associated problems like congenital heart disease or asthma, or a child who is on steroids for nephrotic syndrome. Remember, these high-risk categories, even children with HIV or malnourished children, they are the ones who are at having higher risk of problems related to influenza. Even if there are people in the family like the grandparent, particularly grandfather who is diabetic, grandmother who is asthmatic, of mother who is pregnant, and so on and so forth. So if a child is diagnosed with influenza in the family, then in case if similar people are there in the family, it's important to protect them, because influenza spreads from a child to the adults, as opposed to COVID, which transmits from the adults to children. So you must protect the child. You must give him oseltamivir early so that he doesn't infect those at high risk within the family. So you better start it empirically. WHO also has given a green signal for this, and you need not wait for investigations. However, if you are in dilemma, what is this? This is flu or whether it is something else, then you are fully justified in sending the throat swab for investigation. This was another child who was 3 year old with cough and fever for 5 days. The fever was not settling. The counts were normal and the nasopharyngeal aspirate showed S3N2. Okay. Another child came with normal counts with 38 CRP and the nasopharyngeal aspirate showing S3N2. So remember that the factors on which the clinical response to oseltamivir depend are mainly how early you start the therapy. If you start it early, before 48 hours, then the child will stop spreading the virus to others, and within the child also the response to the therapy will be fast. Okay. And this particular child deceived us. He was 4 year old who came for cough and cold for 5 days, high WBC count and high CRP, and continuously the child had high fever. And this child turned out to be positive for adenovirus. Okay. Remember, once in a while, you will get a different kind of a virus on the nasopharyngeal swab. She was Ria, who was a 5 year old girl, came for high fever for 5 days with cough and cold for 5 days. The child was sick. She had mild wheeze, no crepitations, and the question was whether we put this girl on antibiotics. Now, whenever you come across such a child coming to you after 5 days and who appears sick, general tendency is to give antibiotics at this stage because you are not sure as to what is the diagnosis. Okay. So the child was put on amoxiclav. WBC count was 2800, CRP was 34, and the child was also put on oseltamivir, and nasopharyngeal swab showed rhinovirus. Okay. One should remember that once in a while, you may get other viruses on the throat swab. They are called as bystanders or innocent bystanders. They are always there in, remember, nasopharyngeal swab. And that's why you should be aware that you have to go by the clinical features. Okay. The sensitivity of influenza PCR is quite good, but as I told you, it depends on the person who collects the nasopharyngeal swab, and you must base your decisions on clinical examination. If you get the report positive for H1N1 or H3N2, well and good, but you should be aware that clinical presentation is also important. So even if you do not get a virus on the nasopharyngeal swab, you are fully justified in giving oseltamivir, provided the clinical features are suggestive of influenza. And then this was Flora, 7 year old daughter of the IT sector parents. They are from the information technology sector, came for high fever for 3 days, throat irritation, and this child had examination 2 days later. The throat was showing mild congestion. The child was given paracetamol, and fluid adenoviral cases were rampant around. Okay. So here, what to do? When such a child comes to you, always remember that you have to take the help of investigations. Okay. Particularly if the parents are very anxious. So you collect the blood and do the complete blood count and CRP. If you're not very, very convinced about the viral nature and the parents are very, very insistent. Okay. You also can take a throat swab, and you can also think of starting empiric oseltamivir. But what I'm trying to tell you is that try to explain to the parents that all these problems almost always are viral. Remember, 90% cases coming to us in the OPD for viral infections are viral. So all these investigations like CBC and CRP and the throat swab, they are really, really not required. The patients have to be a bit patient. The doctor also has to be a little patient. He must wait for 3 or 4 or 5 days, and then in case if the child's condition is not very good, then he can ask the parents to get the investigations done. I always say that for viral infections, the slogan which is written under the photograph of Satya Shri Sai Baba is Shraddha and Saburi. These are very important. So you should have faith in the doctor, and you should also have patience, so you will not be required to give unnecessary antibiotics. And as I told you, generally, in case if someone asks you as to how long should oseltamivir be administered, so for the therapeutic purposes, it is given for 5 days, and for preventive purposes, it's given in the once daily dose for 10 days. And this was Tejas, a 3-year-old boy, which came for cough for a week and high fever for 3 days with crepitations. He was put on coamoxiclav, and he was admitted for persistent fever, was given IV amoxiclav, and the parameters related to the WBCs and the CRP were normal. The throat swab showed influenza A, and depending on the report, oseltamivir was added. Now the question was whether I discontinue this IV augmentin. Obviously, in this case, it was not necessary to continue because the WBC count and the CRP were not indicative of bacterial infection at all. So when it comes to continuation or discontinuation of antibiotics along with antivirals, it has to be very, very important judgment of the pediatrician concerned. So in case if you do not have any supporting evidence for calling it bacterial, you better either not start it, or if you have started it and if you get the report of H1N1 or H3N2, you better discontinue. But everything depends on your clinical examination. And this is a part of the antibiotic stewardship. So in case if you get PCR positive, then you have to always think whether I need to continue or whether I need to stop. Of course, never escalate the antibiotics provided the reports are not at all suggestive of any bacterial infection. Okay. Now the mother says that there is the younger sib who is 8 months old, who has also developed high fever since yesterday evening, and the elder one already has been diagnosed as influenza. What to do? So the answer is yes, in case if there is some contact who is in the high risk category. Remember that all children under the age of 5, they come under the high risk category, particularly children under the age of 2 years. You must, put them on oseltamivir in a prophylactic manner. Okay. And there have been quite a few cases during this particular season of influenza who had involvement of the brain and the neurological complications of influenza, like simple febrile convulsion and influenza associated encephalopathy, acute necrotizing encephalitis, Guillain-Barré syndrome, aseptic meningitis are very well known. So one should be aware that if a child comes to you for fever with convulsions, you must always wait and watch whether this child also has in addition certain pointers to tell you that this is influenza and nothing else. And these are the cases where you must be aware that co-infection with other viruses like RSV also can occur. During this particular season, we had quite a few cases which came for influenza along with respiratory syncytial virus. But know that in addition to the neurological complications which I just told you, respiratory complications like otitis media, which already I alluded to, and also pneumonia, which could be either a primary viral pneumonia, which is common in children with underlying, risk factors, and usually pneumonia is associated with Streptococcus pneumoniae or Staphylococcus aureus co-infection or secondary bacterial infection. And remember that 25% of children with influenza can get secondary bacterial infection. And that is why not only influenza vaccine, but you must see that children also receive pneumococcal vaccine, because once a child receives both these vaccines, he will be protected against secondary pneumonia also. So basically, influenza vaccine will protect him against influenza to a great extent, and pneumococcal vaccine will prevent against bacterial pneumonias. Okay. Remember that there are certain children who come with toxic shock syndrome. There are some children who can have myocarditis and pericarditis, though not very common, and myositis. Remember that in children who have influenza B, particularly boys who are a little older, like 6 to 9 years, there is involvement of both the gastrocnemius muscles and the soleus muscles, and this is the reason for severe bilateral calf muscle pain and inability to walk. Hepatic complications in the form of Rye syndrome are also known, and they are the ones which are seen, and they are related to exposure to salicylates, particularly in children with influenza B. Remember that influenza can be prevented by giving flu vaccine, and that's why I always say that along with happy birthday to you, one must tell the entire family happy birthday to flu, meaning thereby every year on the happy birthday, the child as well as the adult in the family must receive the influenza vaccine. See, it is important that we protect ourselves as medical fraternity and also protect our staff members, the nurses, the ward boys, the ayas, against influenza, because children, they come in plenty during the season. Many times when we examine, they directly cough on our face, and in case if we have not protected ourselves with the mask, then these viruses will rapidly spread to the lower respiratory tract. In case if you have some comorbidity, like suppose, many of us have diabetes, many of us are having asthma, many of us have some other problem, and that's why we are, many of us are in the high risk category. So it is important that you protect yourselves. Otherwise, you will have to treat yourself every time you get influenza. Okay. So it is better to use all the protective measures. And that's why remember that this influenza virus, no doubt, is a fast and a furious virus with, abrupt onset, high transmissibility, rapid progression, fast development of complications like ARDS. And of course, that's why you have to use oseltamivir very, very fast. There are certain preventive measures. One of them I told you, that is the mask. And of course, we have learned a lot about these measures during COVID. So sanitization, mask, and social distancing, along with following the cough etiquettes like coughing in the elbow and the Hasta Pancha Sutri. 5 rules related to the use of the hand, like hand washing, hand shaking to be avoided, handkerchief to be used, keeping others at a hand distance, and avoiding hand touching. See, all these viruses, they are carried on the hand. So if you cough in the hand, then the hand touches some other place, there will be spread. So it is better that you cough in the elbow. Okay. Also use handkerchief. Also avoid handshake, because you are unknowingly transmitting the virus from you to the other person. And after examination of a child, it's better that you wash the hands. So all these are preventive measures. So what we have seen is that influenza is not that simple. I told you it's the father of all those influenza like illnesses. It is a treatable viral infection. And that's why whenever a child comes for cold, cough, and fever, many of us reflexly write antibiotics like amoxicillin. Okay. This is something which we must think about, whether we need to think of viruses first or bacteria. Obviously, viruses first. And that too, treatable viruses like influenza. So with that, remember that we have to prevent and treat influenza right on time. With that, I say namaste, and from today onwards, let us decide not to shake the hands, but say namaste and wave bye bye to our colleagues when we depart. So with that, I thank you for a patient listening. I stop sharing my screen and hand over the proceedings to Dr. Prashant.
Sir, thank you very much. As usual, it was very nice and very informative. And I liked your thing, but certainly not horrible. You are audible, visible. But that was lovely, sir. I'll use it somewhere. Thanks all the doctor who took time from the schedule and attended this webinar. Thank you, marketing and sales team of Hitro for super coordination. Thank you, IT team. Thanks, Payal. Thanks, sir. Payal, you want to say add something?
No, sir, I think every time I hear Dr. Pramod Jog talk about, role of oseltamivir or in flu virus in general, it actually has a new perspective every
Absolutely
time.
correct. Every time we
A new
learn.
information,
Yeah.
especially I as a marketer, for me, what caught attention was happy birthday to you and happy birthday to flu.
That
I
was
think that is
wonderful. Yeah,
something
yeah,
I
yeah.
will definitely use, sir, in my communication. Sometimes you help me a lot in preparing communication. So it's always wonderful to hear session
Yes,
from
yes,
you.
yes. Thanks, sir. Thank you so much.
Thank you so much, sir.
Thanks,
Yes.
Payal. Sanjana,
Namaste.
we can
Okay.
sign. Sir, you can sign off.
Okay.
You
Thank
too,
you.
sir,
Yes.
Parva.
Bye-bye.
Sure.
Yeah.
Sure.
Bye.
Bye.
Bye.